Hello, everyone, and welcome to the Gray Couch, where we will discuss all things ABA, entrepreneurship, and lifestyle. We have a very special series that is dedicated to parents as well as parents of children with special needs. Today, I am extremely excited to have Dr. Natalia Fuller join us on the Gray Couch to discuss the importance of therapy for parents of special needs children, as well as parents in general, and how to build trust in medical professionals or therapists. Can you please tell us about yourself?
Absolutely. Hello, everyone. So I'm Dr. Natalia Fuller. I also go by Dr. Canary on Instagram. I am a psychiatrist as well as a certified sex therapy. And so pretty much my 9 to 5 is working with patients that deal with bipolar disorder, schizophrenia, depression, PTSD. And then one of my side hustles is I deal with adults that have maybe sexual trauma, high or low libidos, sexuality issues, intimacy issues. And so I do sex therapy as well on the side.
Okay, well, thank you. And I know you mentioned, you operate as a psychiatrist as well as a therapist. So when thinking of therapy in general, what would you say therapy is, and why do you think therapy is important?
Absolutely. So what therapy is a chance for an individual to go and get counseling. Therapy is made to help heal you from whatever circumstances, PTSD, any major life events that you may have had and that you need healing from. And it's also for those that might not even feel like they've had any traumatic events in the past, but maybe they're trying to figure out who they are as a person, religious things. So you can find literally a therapist for any and every part of your life or anything that you're going through. So from small children to adults, there's all different types of therapy. There's therapy for different types of cultures, religions, different things like that. And the reason why I feel that therapy is so important is because life itself is traumatizing. Regardless, even if you have a great life, we've all had unfortunate circumstances or things happen, whether it's death, illness, even everyone going through the pandemic. That is a major life change. That's a major life shift, to have to stay in the house for weeks on end. And a lot of people, it was very psychologically damaging for a lot of individuals. So we help as therapists, psychiatrists, mental health counselors, because there's different types of therapists, we pretty much help you cope with life circumstances.
And why would you say most people pursue therapy? I know you generally mention, that we all have experienced some sort of trauma just, with daily living. It may not be as impactful where some need to seek out therapy, but in your, experience, what would you say are some reasons as to why most people would seek therapy?
I personally think that no matter what, I think everyone should at least try therapy once. I think everyone should. But from what I've seen in my personal experience, why people seek out therapy is usually they want to heal. Because the circumstances that we have as children, people fail to realize that they follow us into adolescence. They follow us into adulthood. They follow us into every component of our life. And if you don't allow yourself to heal from that, it's going to continue to affect your life. And sometimes it might be negative. Sometimes it might be positive. More so times I've seen childhood trauma, of course, negatively affect individuals. And that's why I feel like it's so important to break those stigmas that we have in the mental health community, because therapy can benefit everyone in any instance.
Yeah. So I guess for those who, really don't know much about therapy aside from maybe what is portrayed on, TV of this, you lay on the couch, person has their pad and their pencil and you're talking and they're writing notes about
the movie version.
Right. Is that what therapy looks like?
Honestly, it really depends who you go to.
Okay.
I'm young, so I do come from a very different era, I think, of therapy. When I first got into this field, I was very fortunate enough to work with some of the top therapists, psychiatrists, mental health counselors in the U.S. and in the state of Georgia, essentially. And I've seen them all do different. They've all had their own way of doing therapy.
Okay.
So one of my mentors, Dr. Klopper, who is one of the top psychiatrists here in Atlanta, when I was in medical school, I did my rotations with him, and he was like, I guess, a stereotypical movie therapist, psychiatrist. He had this huge couch, and you would sit on one end, and then he would have his chair, and he had his notepad. He was very old school. But then now most psychiatrists, they're behind maybe a computer, laptop, iPad. I sometimes like to take my notes on an iPad, and then sometimes I actually like to write my notes out. So it just really depends. But there's also play therapy for children, which I'm actually trying to get a certification in. And that to me is amazing because you're playing, you know, with the children. And so that's a different component. So there's really not just one way to do therapy. I've even seen therapy in nature. I've done that a couple times. It's not my specialty. I have to get training on it, but I did a short little fellowship with a therapist that did her therapy sessions at parks. And it was like you were having a picnic.
Yeah.
And she didn't really typically write anything down. So, I mean, it was just almost a very free flowing conversation. And I'd never seen anything like that. I didn't even know that existed.
Yeah. So that's really great because it seems like, you know, therapy to an extent can be customized to the needs of the individual. So if it is that you're looking for more of the like stereotypic style of therapy, there's some people out there. If you're looking for play-based for like a child or, you know, a young adolescent, that may be the route to go. Absolutely. Or like nature-based or whatever the case may be.
Because people sometimes see therapy as, it can be intimidating. And I think that's what I get a lot of times, especially with millennials. They definitely see therapy as intimidating, and it shouldn't be that way. You have to find a therapist that's a good fit for you. That's the first start.
Right. And do therapists have a particular niche as well? I know you mentioned earlier there's a certain population that you typically service. So each therapist may have their own area of expertise or a niche.
Absolutely. So I think that every therapist kind of has a set type of patients that they work with, because we all have different credentials. And then when you're doing therapy, like getting your master's, like I did mine in clinical psych, but then I did like a subspecialty in sexuality, human sexuality. And then I also did one on like children, adolescents. I took a whole bunch of courses in that because I essentially want to be a children adolescent psychiatrist. I want to specialize specifically for that population. So a lot of therapists kind of hone in on what type of population that they want to work with. And they'll tell you in their bios, because there's so many different courses that you can take for therapy. So you want to go to a therapist that has that framework and that body of work with that specialty that you're looking for.
Okay. And for those that may, you know, go on the pursuit to either seek out therapy or currently in therapy, if someone is in therapy, does that automatically mean that they will be prescribed medication?
Absolutely not. And I think that as a psychiatrist, I'm known AKA as like a drug pusher, a legal drug pusher. But the funny thing is I don't typically give my patients medication unless they want it and there's absolutely a need for it. A lot of times, especially with children and adolescents, I'm against medication. Because when I was in medical school, a lot of times I saw a lot of young Black males, they have the highest rates of getting Vyvanse and Adderall, and the psychological effects over the years, once you follow them, you can see that. And so I feel like a lot of times, especially with kids, Black males that are dealing with ADHD, because they're always trying to push medication on them, I tell the parents all the time, like, it's your right as a parent to say no. You're an advocate for your child. So that's very important. If something doesn't feel right to you, say no, question it, do your research. And that's where parents kind of sometimes they don't do enough research all the time. Because if you look at the chemical compound of Adderall and Vyvanse, I promise you that's something you're not going to want to give your kids.
Yeah.
So there are other alternative methods. And so anytime I get a patient, I like to speak to them about alternative methods. So if they come to me and they say, oh, well, my child was on Adderall, Vyvanse before, and I just want to put them on that. And I'm like, okay, well, what have you changed? Like, before we put your child on medication or you on medication, what about your nutrition? Right. How is your diet? Are the kids eating a lot of sugary juices and sodas? Are you eating a lot of sugary juices and sodas? Because that's going to make you hyper, and it's going to make a kid hyper. Right. Are you giving your kids coffee? Some parents give their kids coffee at like 10, 11 years old. Yeah. They don't really need that. You know, are your kids in sports? Are you keeping them active? You know, because a lot of it, you know, ADHD and ADD is about attention and them being overactive. Well, if your kid has after school programs, if you're keeping your child busy and they're in karate and they're in soccer and they're in football, I promise you they're going to be tired.
Right. Yeah, right. You're not going to see all that energy being exerted throughout your day.
You're not. But nowadays, kids, they're not playing outside. They are playing video games for like, I think the study said on an average, kids play video games like 6 to 10 hours.
Wow.
Yes. So if your child is playing video games all day, and that's another thing, if they're able to play video games for that long, they do not have any attention issues. It's just what they're interested in.
Like selective. With my homework, no, it's not happening. But with anything fun and exciting, absolutely, I can pay attention to.
Exactly.
Cool. So, in terms of, you know, my work, I work a lot with parents of special needs children. And oftentimes I know that, you know, with being a parent in general, but especially a parent of a child with special needs, there can be a lot of difficulties or barriers as it relates to just daily living, you know, relationships, and just like personal things, or maybe mom or dad may have, you know, just something personal happening. So what would you say is a way to identify or know if a parent may, like in yourself as a parent, if you need therapy, or like what type of therapy should a parent maybe seek out? And the reason why I ask this is because oftentimes, you know, parents may become comfortable with their child's therapist, let's say that, or a service provider that is working with their family, but not really able to make that next step to get some support for themselves.
Right.
So what would you say is like a good first step to a parent seeking that out for themselves, or when they're, or knowing when to identify, like, hey, I definitely need some type of support for me?
Absolutely. Well, that kind of goes back to what I said earlier, how I feel like everyone literally needs therapy, hopefully before you have the kids. But sometimes, you know, it takes some individuals a little bit longer about self-awareness. And that's okay, because I think kids, they definitely bring out a different side of you. You know, you're going to get frustrated, you're going to get impatient. And especially, you know, my heart goes out to the parents that have, you know, autistic children and children with special needs, because that takes a different level of patience. I've definitely in the past worked with some autistic kids, and they were a pleasure to work with. It always seems like they're kind of in their own world, and you're just a piece of that puzzle in their world. And so that's really interesting to see. But for parents, a lot of the times the parents have other children, and you can see that frustration, and you can see that they're just tired, honestly, because it's not easy being a parent, and then having a child with special needs and having to cater to that and be understanding to that situation and research that. That's on a different level. I always tell parents, if you're starting to feel like and some of the clues to these things are like, if you're constantly feeling frustrated, if you're constantly dealing with depression, a normal amount of depression is typically a couple of days. I would say 3 to 5 days. Anything over a week that is persistent, consistently, then you have a bit of an issue, and you might be dealing with something a little bit deeper. So if you're noticing a constant shift in your moods, you're noticing that you're constantly agitated, not only with yourself, but with your child. It's like they're constantly annoying you, or your partner's annoying you. You're not getting things done. You're having issues with insomnia. You know, those are all the signs that you need some help.
Right.
And, like I said, there's nothing wrong with seeking therapy, even as a parent
Mm-hmm.
and your child is in therapy. I always encourage parents that if their children are in therapy, that they should also go to therapy. And then you can also do family therapy. So
Mm-hmm.
once everyone individually has completed therapy, I've always found that family therapy, I mean, it really works wonders when people are willing to give it a chance.
Yeah, awesome. Well, thank you so much for that. So my next question for you is, how can a family go about building trust with either medical professionals or therapists? I know in certain communities there is,
Yes.
a stigma in general surrounding mental health,
Mhm.
and seeking out therapy, or also with the understanding of you're supposed to deal with your
Mhm.
quote unquote issues or problems, and how to
Right.
don't go and speak to anyone else about what's going on or what you may struggle
Absolutely.
with, or like you should be able to bear what you've been given, kind of like those
Yeah.
types of things. So when someone may be faced with being told that continuously, and not trusting in medical professionals or therapists, what would be a way that those individuals that may really want to seek therapy or seek medical services, them being able to learn or build that trust with those professionals? What would be some tips?
That is such an amazing question. And I don't get asked that question very often. So that's a great one. That's just a great question. You do hear that a lot in certain communities. They say pray about it. And
Hmm.
I come from a religious family, a spiritual family. So yes, I think prayer can work wonders.
Hmm.
But I also think that sometimes you need that extra bit of help. And the way you do that is you do your research. So Instagram, Facebook, it's provided us with tools that it's easy to meet people, it's easy
Right.
to network. So there's so many groups on Instagram. If you literally put in therapy under hashtags,
Hmm.
thousands of therapists will pop up. That's how some of my clients have found me
Hmm.
for sex therapy. So it's amazing how using the tools that everyone technically uses
Right.
anyway, and even just Googling,
Hmm.
but really when you're looking for a therapist, I always tell people there is a system, and I don't like to call it like a hierarchy system,
Hmm.
but people think that they need to jump from, okay, I need therapy, let me go straight to a psychiatrist.
Right.
Not necessarily, because I'm gonna be honest, we're the most expensive. So yeah, it can be very pricey. So typically, sometimes you can even have a life coach. So
Hmm.
I've had friends come to me and they're like, I just want to get myself organized. I want to figure out what I want to do in life. Go to a life coach for that.
Yeah.
And if you feel like, okay, I have trauma in my life, you
Hmm.
can go to a mental health counselor.
Right.
So you can start there, or you can even go to a psychologist. They're going to be a bit more expensive than a mental health counselor.
Hmm.
And then if you feel like, okay, well, you know what? I need medication, because typically that's why people come to us, because they decide they want medication. Then
Hmm.
they come to a psychiatrist. But doing your research and asking questions, I've noticed a lot of times with clients that I take on, they don't ask me any questions. They don't
Yeah.
know my background. They don't know what school I went to.
Hmm.
And I'm like, question me. Like,
Yeah.
I'm working for you.
Hmm.
So it is your right to question. And I think because people, they see, the titles and they get nervous and they're like, oh, I don't want to ask any questions. I don't want to, ruffle any feathers. And I
Right.
tell people all the time, like, if you go to a therapist and you feel as though you're ruffling any feathers, or you feel that you are a bother to your therapist,
Hmm.
then that's not the therapist for you.
Right.
Because there should be some sort of bond, there should be some sort of connection between you and
Hmm.
your therapist. You should feel calm and soothing. You
Hmm.
should want to speak to your therapist.
Hmm.
So that's one of the tips I would give. And then as far as finding a therapist, honestly, like I said, Instagram, Facebook,
Yeah.
you can literally type in therapy. A ton of therapists will pop up.
Hmm.
Even if you Google free therapy sessions, if you need inexpensive therapy,
Hmm.
that's out there as well, where sessions are $5, or they go based off of your insurance. So,
Hmm.
if you want to seek therapy, there really is not a reason to. And if you need resources, you can definitely contact me. I'm always willing to give resources out to people that need it.
Okay, awesome. Well, thank you. And I know that we're, talking about therapy in general, and I know we just recently spoke about parents and things like that. So I know you also mentioned that, you're a certified sex therapist as well. So do you have any suggestions as to maybe what parents can do if, they do have a child, or, a child with a special needs, and there's that breakdown between the relationship of both parents? And because I know too, I see in terms of with my practice, a lot of times the child is the focal point and the priority, and then at times the relationship can become strained because all focus is on the child. So any kind of like tips that parents can do to maybe like set time aside, or how to manage, yes, we have to an extent prioritize our child, but also we have to prioritize our relationship.
Absolutely. Yes, absolutely. So I see that a lot. Because like it's hard to juggle. Women, we do so much. Like, I honestly sometimes don't even know how we do it all. We're moms, we're daughters, we're wives, which in itself, where we have to cook, clean. We're counselors to our children, we're counselors to our husband. We're a shoulder to lean on to our girlfriend. So we do it all. But in a relationship, I think that you have to remember you're still human, and you're going to have those sexual needs. And I think sometimes when you're dealing, especially with children with special needs, you kind of, like you said, you forget, because the child is the focal point. And so I think that a lot of times you have to take a step back. So whether it's revitalizing your relationship with your husband, and sometimes that means while the kids maybe are in school, going on a quick lunch date, having dinner together. If you have a community, utilize that. That's what the grandparents are for. Utilize them. Ship them kids off to the grandparents for a couple of days, because you need that at least once a month. You have to have that. You will literally drive yourself crazy. I've seen marriages destroyed because husbands felt like, they didn't have a wife anymore. The wives felt like they didn't have a husband anymore. And, you have to have that balance in your life. So I always tell my couples, even if you have to get a schedule together, and I don't typically like to do schedules for sex, because I feel like that should be just spontaneous and just whenever you all are both in the mood. But when it comes to date night, definitely get a schedule together for your date night. Find a babysitter that you trust. There's websites out there actually that have babysitters that are certified with dealing with children with special needs. So utilize that. And then you're going to have to work on your communication. And rebuilding that up, because your children cannot just be your focal point. You have to take care of one another, and you have to take care of yourself. So even if it's a once a month thing or a twice a month thing, how often you can do it, revitalize your sex life. You just have to do it. And I tell people all the time, you can do it anywhere. I think people feel like they have to just be in the bedroom, but I'm like, utilize that kitchen, utilize the washer and dryer, utilize the car. Like, quickies are great, and they're not just great because you're having sex. They're great because it gets those endorphins going, and it can help jumpstart a day and revitalize your day. So, get spontaneous with it. I think people forget about intimacy and being spontaneous sometimes in their marriage, and you got to bring that back.
It is that someone is paired with a therapist, but don't think that they're a fit for them. What should they do from there?
Okay, so and I've seen this a lot, and I've even actually had a couple clients that I felt like I could not help them. A lot of males, sometimes I feel like that it's better if they go to male therapists, and that's just my personal opinion. But if you are with a therapist and you feel like that therapist is not a good fit, one, I want to say don't give up, because I think a lot of people, they feel frustrated and they're like, oh, this therapist isn't for me. That means I'm not going to find what. No. Don't give up. Ask that therapist. Say, you know what? I don't feel like this is a good fit. Is there someone else that you could refer me to? But also, that's a part of doing your research. Know what you're looking for, because a lot of times people just be like, okay, I just want to find a therapist. Well, does it matter if it's male or female? If you're a male, like I said, typically I think going to a male is good. If you're a female, typically going to a female. If you've dealt with sexual trauma, you might not want to go, you might want to stick with whatever sex did not perpetrate you.
Mm-hmm.
So if you're a male and you were sexually abused by a female, then you really need to go to a male therapist. Mm-hmm. And if you were female, same thing. So also religion. There are religious therapists. I think people forget about that. So if you are religious and you want a Christian-based therapist or someone that's Muslim, mm-hmm. there are people out there for that. You can always ask your church. I think that's a great starting point because churches usually always have information about what therapists. And I'm telling you, Instagram, Facebook, and Google, you would be amazed at what therapists that you can find on there. And like I said, if your funds are short, don't give up. That doesn't mean that you can't mm-hmm. see a therapist. Call your insurance company. A lot of patients always forget to call their insurance company, but call their insurance company, your insurance company, and figure out what type of counseling they offer. Mm-hmm. Because now some insurance companies are offering where you can get a free therapy session or two or three, and they'll have therapists in their book that you can go to. Mm-hmm. So that's another good point. And like I said, also make sure you're asking the right questions, because after you ask certain questions, you'll realize if that therapist is a good fit for you mm-hmm. or not. You know, ask them about their experience, ask them about their own religious views. All those are questions that you can ask and that mm-hmm. you should not be afraid to ask, because you want to make sure that you're comfortable and you want to make sure that they're providing you with the correct information, because all therapists are not created equal.
Yeah, I agree. Thank you so much, Dr. Fuller, for, just your wisdom and sharing all of your expertise. I definitely got some great key takeaways from the discussion today that anybody, no matter what, can benefit, from therapy, identifying who would be the best fit for you and asking those questions, because like you said, therapists are to an extent working for you. So you need to make sure that that person that you're opting into is someone that, would be a good fit. And, for a lot of the parents, kind of prioritizing yourself as well as your relationship, because, that can help to keep it afloat, or, if it has been some breakdowns, to kind of start that repairing process. Absolutely. So if it is that someone wants to get further connected with you, how could they go about doing that?
So you can find me on social media at drdr.canary, Canary. I do try and answer my DMs as much as possible. You can also, my business page is mind.body.sex on Instagram. And my website just literally rolled out. You can email me on my website, but I am fully booked for my appointment. So if you go on there and you see that you can't schedule an appointment, just email me. I try and do my best to squeeze everybody in. But my website is Dr. MBS, which stands for mindbodysex.com. And you can find me on there. And DM me, shoot me an email. Like I said, if you go to the website, my email's on there. It's very accessible. And I do respond back as quickly as I can. Give me a couple business days, but I definitely will respond.
Awesome. Well, thank you so much. And I'm sure that people will be sure to reach out to you